Did you know that before you even hold your baby in your arms, there are ways to peek into their future health? No, not in a fortune-telling kind of way, but through scientific testing. One of the most talked about methods during pregnancy is the double marker test. If you're rounding out your first trimester and hearing this term for the first time, you're not alone. The name might sound a bit technical, but understanding it could ease your mind or guide your next steps in this incredible journey. What is the double marker test, and why does it matter? Let's start simple. The double marker test is like a spotlight shining on two critical markers in your blood: free beta human chorionic gonadotrophin, beta HCG, and pregnancy-associated plasma protein A, PAP-A. Think of it as checking your pregnancy's playlist to spot any notes that seem out of tune. Why do this? Because your doctor is looking for signs of chromosomal abnormalities that could affect your baby's development. It's not about painting a complete picture. The double marker test doesn't diagnose conditions. Instead, it helps map out a risk scale, telling you if there's a low, moderate, or high chance of certain genetic conditions like Down syndrome, trisomy 21, Edwards syndrome, trisomy 18, and Patau syndrome, trisomy 13. These are all conditions where an extra chromosome causes developmental challenges. How does this test work? The test is straightforward: a simple blood draw between weeks 11 and 14 of your pregnancy. Don't worry, there's no fasting involved, so breakfast beforehand is fair game. Your doctor will write an order for the test, and then it's off to the lab. In about 3 days to a week, you'll get your results. But here's the thing: the blood draw alone doesn't tell the whole story. Enter the nuchal translucency (NT) scan. For a complete picture, doctors pair the double marker test with an NT scan. Picture an ultrasound that zeroes in on the clear tissue at the back of your baby's neck. Why there? Because, at this stage, too much fluid in that spot can signal a higher risk of chromosomal abnormalities. Combined with your age and medical history, this screening creates a more comprehensive risk assessment. Is this test for everyone? Not exactly. It's often recommended for people over 35 or those with a family history of chromosomal issues. But it's a choice, not a requirement. Before deciding, ask yourself what knowing the results would mean. Would it help ease your worries? Or add to them? Would a higher risk result push you to seek more invasive testing like amniocentesis, or would it simply guide your planning? Why bother with screening if it's not 100% accurate? Good question. Let's compare it to weather forecasting. You wouldn't expect it to be spot on every time, but if there's a strong chance of rain, you'll probably grab an umbrella. Similarly, a low-risk result can offer reassurance, while a higher risk may push you to consider further, more conclusive testing. Knowing ahead of time could also help you prepare for the possibility of a baby with special needs, ensuring you have support and resources in place. What are the risks? Good news, there aren't any. The double marker test is non-invasive, so the only discomfort comes from the blood draw itself. The NT scan? Also a routine and safe. Think of it as one of the many steps in ensuring your pregnancy is on track. Decoding the results. When the results come back, you'll see them labeled as low, moderate, or high risk. If you're in the low risk category, or screen negative, great. That means it's unlikely your baby has one of these chromosomal issues. But, remember, low risk isn't a guarantee. It's like being told there's a 10% chance of rain. It's probably clear skies, but you can't bet your life on it. If your results are moderate or high risk, or screen positive, don't panic. It's not a diagnosis, just an alert. Your doctor might recommend further testing, like non-invasive prenatal testing, NIPT, which looks at fragments of your baby's DNA circulating in your blood, or even more invasive options like amniocentesis or chorionic villus sampling, CVS. These tests come with a small risk but provide a definitive answer. What about the costs? Like many aspects of pregnancy care, what you pay can vary. It depends on your insurance and where you live. Some plans cover the test, but you'll want to check with your provider or call the lab to get the details. If you don't have insurance, Many hospitals offer payment plans or rebates, so it's worth asking. Pros and cons, making your choice. Is the double marker test worth it? It depends on you. On one hand, having an early understanding can bring peace of mind or prepare you for what's ahead. On the other, results can be anxiety-inducing and lead to further testing. Here's what to consider. Pros: early insight helps you know more about your baby's health sooner. Non-invasive, no risk to you or your baby. Part of a comprehensive approach, combined with the NT scan, it provides a clearer picture. Cons: predictive, not definitive, can't tell you for a certain if your baby has an issue. Possible stress: high-risk results may lead to more anxiety or testing. Limited scope, only screens for trisomy 21, 18, and 13, not other conditions. Wrapping up, a thoughtful step. If there's one takeaway, it's that a double marker test is a tool, a helpful one, but not the be-all and end-all. It's a step in your journey, meant to guide you. Whether you choose to take it depends on how you weigh the value of knowing versus not knowing. Discuss it with your doctor, talk to your partner, and reflect on what's best for you. Pregnancy is full of choices. Each decision shapes your path, but whatever you decide, stay informed and keep communication with your healthcare provider open. No question is too small when it comes to the health of you and your baby.